So when you're talking about urology, there's one thing, it's called a stent. It's a ureteral stent. And if you've had kidney stones or any type of procedure on your tube that drains from the kidney to the bladder called the ureter, if you've had any surgery on that area, then you know you've had an experience with a stent. And what a stent does, here's the kidney. It drains down into the bladder. This would be the bladder down here. And a stent is a plastic tube. It's a plastic tube that is in the kidney. It drains down this tube and into the bladder. And what it's used for is to allow the kidney to drain. Oftentimes there's a kidney stone that's blocking the drainage, and sometimes a stent is put in just to drain the kidney. Urine is made by the kidney and drains through here, and the urine actually will drain through the stent and around the stent. And it's important. These things are important. They're long. They're anywhere from 22 to 30 centimeters in length. They're usually made of some type of soft plastic. Sometimes they can have a string attached to them. So even though they're in place, that string is used for removal purposes to remove the stent. And what you do is just grab hold of the string, pull the stent, and the stent, like I say, is this long. It has to come down this tube and all the way out. So obviously you don't want to remove that stent unless you talk to your doctor. The person that put this stent in, you don't want to remove it until you talk to that urologist. It's important to know with stents that they can cause pain and discomfort. So pain can often be like a stone. So it can cause flank pain or side discomfort. It can cause pain in the side or the abdomen. It also can cause bladder spasms because this stent will slide, and as you breathe, the kidney moves, so it will pull the stent. And the bladder, as the bladder empties with urination, it can move as well. And so this stent is often always in motion and always moving, and so it's the movement of the stent that causes the discomfort, bladder spasms, and it can also cause what's called hematuria, or blood in the urine, essentially. So it's not uncommon to have blood in the urine with a stent. Stents are important. A lot of people have them. Usually they're associated, like I say, with kidney stone procedures, or if someone goes in with a ureteroscope and lasers a kidney stone, oftentimes a stent will be in place to allow this swelling to resolve with the stent in place, and then the stent gets removed and everything usually gets back to normal. So stents are important. They're a big part of urology and what urologists do to help patients. They're also used for any kind of surgery that's done on the ureter. A stent is often put in place to allow things to heal and drain appropriately. That's it. So that's stents in a nutshell. There's a lot more to it, but these are the basics. I'm Dr. William Stiles, urologyanswers.com. Thanks for watching.